Hi everyone, my name is Dr. Prashant and I am a pediatric surgeon practicing here in Pune and also a health and wellness coach for the past 10 plus years. In today's video, we are going to talk about a very important topic about how to investigate a case of PCOS. This is a very common condition. It affects 1 in 5 women here in India and even internationally. And a lot of women suffer from this condition, and we need to identify, we need to understand how to evaluate this. Okay, so PCOS involves a combination of clinical assessment, laboratory test, and even imaging. So these three are combined together to come to an assessment, proper assessment of PCOS. Okay, we'll talk about two kinds of approaches. One is a traditional approach, which is done for many years now, and there is a new approach also, which is called as a functional medicine approach, in which we actually go much beyond the regular tests which are done, and this helps in uncovering the root cause and also helps us to personalize the treatment. So we are going deeper, we are going to the core, identifying the root cause and helping the patient really to treat the root cause rather than just treating the symptoms. So let's talk about both the approaches. The first is a traditional approach. Now the diagnosis of PCOS is typically made using some criteria which is called as Rotterdam criteria. It's a very famous criteria and everybody uses it, and there are three criteria out of which two have to be satisfied. Okay, now the first one is something called as oligomenorrhea or an ovulation. We have talked about it, but let's talk into a little more details. So for what do you mean by oligomenorrhea is there are irregular periods. Typically they are delayed, they are longer than 35 days, they are fewer than 8 periods in a year, or sometimes there can be even primary amenorrhea as well. So this is the first criteria. Second is hyperandrogenism. It can be clinical or even biochemical. So in clinical you can have signs of increased male hormones like hirsutism, which is like you get hair on the this area, even on this area, like males have. Okay, the second is acne. Now this can be something very disturbing and they just refuse to go. And the next is alopecia. Okay, androgenic type of alopecia, where they start losing the hair on the scalp like males lose. So this is clinical assessment. The next is biochemical. So we have to go deeper. Now you do the test and you really see whether you have androgen levels are elevated or not. So on blood testing you will see that your total testosterone, your free testosterone, DHEAS, androstenedione, these levels are elevated. Okay, so it becomes a diagnosis clear cut. Then we have to do an ultrasound to see for ovarian morphology, and if you, let's say, have multiple follicles, typically more than 12 follicles, which are in the range of 2 to 9 millimeters in diameter in each ovary, or you have an increased ovarian volume more than 10 ml in at least one ovary, then that fits into the criteria of PCOS. But what we have to also understand is that sometimes in healthy women, young women, who have similar symptoms like delayed periods and all that, this may not be seen on the ultrasound. So ultrasound may not be reliable in these kind of females, typically young healthy women who have symptoms of PCOS, but on ultrasound it may not be detected. Okay, so these are some of the parameters that we do. Apart from this, we also have to check for other markers. What are those? We have to check the weight, because these can have increased weight. We have to check the BMI, we have to check the blood pressure, and we have to also see for clinical signs of insulin resistance, which is acanthosis nigricans, which are dark velvety skin patches, a hallmark of insulin resistance. Okay, and I have seen this in a lot of patients who have insulin resistance, even males, females who have come to me for overweight issues who have insulin resistance. This is seen surely. Okay, there are other blood tests that we have to do. It's like hormone levels. We have to check for the total and free testosterone. This is important to assess hyperandrogenism, and here free testosterone is actually considered more sensitive than total testosterone. And yes, there are other hormones also which can be elevated like DHEAS, androstenedione. They can also be elevated, leading to hyperandrogenism. The next is LH and FSH ratio. Okay, so you will see that typically the LH is high and FSH is on the lower side, so the ratio is on the higher side, and this is elevated in PCOS, but it's not a very reliable marker on its own as such. Next is prolactin levels. Now this is to rule out hyperprolactinemia, which can also cause menstrual irregularities. So it's more for ruling that out. We also have to evaluate the thyroid function. Now in thyroid function we typically evaluate by TSH levels, but this is to rule out the thyroid dysfunction, because thyroid dysfunction can also lead to menstrual irregularities. So we have to know that we are not dealing with some thyroid issue or not. Okay. Next is 17-hydroxyprogesterone. Now, there is a rare condition which is called as non-classical congenital adrenal hyperplasia, which can also lead to some symptoms which are similar to mimic like PCOS. So we have to rule out this condition by doing this test. Recent times, or probably for a long time now, we have been doing something called as AMH, anti-Mullerian hormone, and this is increasingly used as an alternative for ultrasound, okay, for ovarian morphology. So if you have elevated anti-Mullerian hormone or AMH levels, then it strongly correlates with polycystic ovarian syndrome, and typically this can be elevated almost like 2 to 3 times of the normal. Okay, now there are other metabolic parameters that also we have to check typically for insulin resistance. The first is fasting glucose and insulin levels. Now if these levels are elevated, it is suggestive of insulin resistance. We can also do a oral glucose tolerance test, especially if your insulin levels and fasting blood glucose is within normal limits, and GTT can help us to assess the glucose levels in the right way and also help us to diagnose insulin resistance. HbA1c also can be used. This gives us a long-term blood glucose control, typically for about 3 months. We can also do lipid profile, because a lot of these patients they can have altered lipid profile because of the high sugars. The elevated levels of triglycerides, LDL cholesterol can be seen in these women. Okay, they have a higher risk of dyslipidemias. And we can even do a pelvic ultrasound. Now, pelvic ultrasound is important because it can not only give us the ovarian morphology as such, but it can also give us the thickness of the endometrium. And if the thickness of the endometrium is more, what it indicates is that there is prolonged anovulation, which is stimulating the estrogen levels are on a higher side, and it is stimulating the endometrium, leading to the increased thickness. So it is a marker of anovulation. So that was traditional. Now let's talk about what is functional medicine approach for the PCOS patients. And this approach is very different. Yes, we do some of the investigations which are there in the traditional approach, but this aims to identify the root causes, and it also helps to identify the underlying imbalances which are actually contributing for the PCOS, rather than just managing the symptoms. Okay, it actually considers the interconnectedness of various systems within our body, and these can be unique for every individual. So this type of testing, this type of evaluation is pretty different, and it's very, very important. Okay, so let's go into the depth of it. The first is a detailed history. Now here history becomes very, very important. So dietary habits, what kind of dietary habits they have, whether they have high intake of sugars, dairy and potential triggers, refined carbohydrates, inflammatory foods, high oil consumption, and some food sensitivities. We have to go into the details and check that. Next is stress levels, okay, and how is the adrenal health, okay. So do they have chronic stress, which can actually impact hormone imbalance, okay. And we know that elevated cortisol levels can lead to insulin resistance and even hyperandrogenism. We talked about it in the last video. So this is very important to assess. Next is assessment of the sleep patterns. Okay, now we know that if the sleep is disrupted, it can actually lead to hormonal dysregulation and even insulin resistance. So sleep assessment is very important. Environmental toxins, now this is a big one. Not we don't identify this too much, but yes, if you have endocrine disrupting chemicals in your house like plastics, personal care products, pesticides, then this can be really harmful. Your cookware like aluminum cookware, non-stick, these can also disrupt your hormones. Next is gut health. Now if you have symptoms like bloating, constipation, irritable bowel syndrome, or some other gut health issues, it is indicative of gut dysbiosis. And gut dysbiosis can really influence your inflammation and even hormone metabolism. So it's very important to identify gut dysbiosis. Next is exercise habits. What kind of lifestyle do you lead? It's a sedentary lifestyle, or whether you are active. That is very important, okay, because sedentary lifestyle can lead to hormonal imbalance as well. Next is family history. If you have a strong family history of insulin resistance or diabetes or PCOS, then probably you also have a propensity, but it doesn't mean that you are going to suffer from it, but yes, you have some higher chances. Now what laboratory testing that we can do, which is beyond the conventional traditional approach. So the first is a comprehensive hormonal panel. Now this probably is not done here in India. It's called as a Dutch test, which is a dried urine test for comprehensive hormones. Now, this actually look not only at the hormone levels like estrogen, androgens, progesterone, cortisol, but it also looks at their metabolites. So it really goes deep into it, understanding what's happening with the metabolism of the hormones. And this helps us to understand how the hormones are being processed in our body, how they are detoxified, and this can give us a lot of insights into the estrogen dominance, also on the androgen pathways, and how the adrenal gland is functioning really. Okay, now this test is, I have checked it, probably it's not done here in India. Next is adrenal function testing, which is a salivary cortisol testing. It's a rhythm testing, and there are multiple samples of the saliva which are taken throughout the day to assess the body's stress response and how is the adrenal reserve. Probably this test is also not done here in India as of now. But yes, there are other tests which are advanced insulin resistance markers, which is like HOMA-IR. This is done in India, and I get it done regularly almost in all my patients. Okay, it is called as homeostatic model assessment of insulin resistance. There is another indicator which is QI, which is quantitative insulin sensitivity check index. Now, basically, it is calculated from the fasting glucose and insulin levels. They both are taken at the same time in the fasting stage, and we can have an index through which we can identify whether there is insulin resistance or not. Oral glucose tolerance test with insulin. So it is not just blood glucose, but with insulin. If you do, then this can help us measure how is the glucose and the insulin responses for several hours, okay, after we give a glucose load. So this is a more dynamic test, and it gives us a very good picture about insulin sensitivity. Okay, next is inflammatory markers. Now these markers are very important, and a lot of times these will be positive in these patients of PCOS. So a high sensitive CRP, which is a general marker of inflammation, is often elevated in PCOS. Homocysteine levels, another big one, very important. Okay, it's an amino acid that when elevated can indicate inflammation and also some nutrient deficiencies like B6, B12, folic acid. I get this homocysteine levels done in almost all my patients, and a lot of patients, they are elevated. Okay, next is nutrient deficiencies. Now we don't check for all nutrient deficiencies, but yes, B12, vitamin D levels we definitely check, and vitamin D is often low in women with this PCOS, and we know that this is very vital for hormone regulation and also for insulin sensitivity. Magnesium is the next one. It is important for insulin signaling. Chromium, it plays a very good role in glucose metabolism, important role in glucose metabolism. And zinc, it is involved in hormone synthesis and also skin health. And omega-3 fatty acids, this is very important because we know that omega-3 fatty acids is anti-inflammatory, and yes, if they are low, then we can have a chance of more inflammation in our body, which can lead to hormonal imbalance. Next is gut health markers. This is typically done in those people who have gut dysbiosis, and we can do a stool microbiome testing, okay, which can help us to identify imbalances in the gut bacteria, whether there are any presence of any pathogens and markers of inflammation or malabsorption. So this can be a very important test. It's done here in India, definitely. Okay, we can do a gut microbiome test. The next is intestinal permeability markers. I'm not sure whether we do it here in India. They do a fecal zonulin levels to assess something called as a leaky gut. Now, if the fecal zonulin levels are high, that means we have leaky gut, and that is leading to more of inflammation in our body, which can lead to hormonal evaluation. So you see, if we go into the depth and if we really identify what is the root cause by doing an in-depth analysis, not only in terms of a proper history, but a proper biochemical evaluation and also radiological evaluation, then we can have a complete picture of what's really happening in these patients of PCOS, and then we can actually cater our treatment also accordingly and treat the root cause, and so that these females really do not have to go through all that saga of insulin resistance, weight gain, high visceral fats, hyperlipidemias, diabetes, infertility, and so on. So all these problems can be really addressed if we address the root cause. I hope this video helps you. In subsequent videos, we will also talk about the treatment of PCOS. Thank you very much. Bye-bye.